There's Ross. Ross, do you want to check your audio?
All right, can you guys hear me now? Okay, good.
Yes, we can. Dwayne's getting the live stream. He's going to let us know when we're ready. See, Katie joined us. Good morning, Katie.
I see the stream on this end.
Okay, well, it is past 9 o'clock, so we'll get started. This is the City of Yankton Health Board, and we're meeting here this morning with the purpose of developing a recommendation for the City Commission as it pertains to an extension of their masking ordinance. And they'll be making a determination on a first reading on Monday, February 8th. They will not be voting, however, on any action on this item until Monday, February 22nd. So I just want anyone that's watching the health board or getting information from the health board that while our meeting on Monday is a public meeting and we will have probably have some discussion on this item, the commission won't be taking action at this particular time. It'll be February 22nd. So I'm going to introduce the members of the health board and ex officio so people know who they are, just because we haven't met for a while, fortunately. And then we'll get started. For our voting members, we have our mayor, Nathan Johnson. We have Dr. Mary Milroy, myself, Amy Leone, I'm the city manager. Ex officio members today, we have Commander Jason Foote, Community Development Director Dave Mingo, Community Development Manager Brad Bees, as well as our City Attorney Ross Denherter, and acting as an ex officio capacity today, Katie Huff, who is with Avera palliative care. Excuse me, I was going to say hospice care, but I believe it's palliative care. So Ross, do you want to provide us a little bit, just without a lot of detail, because I don't believe any of the meat of the ordinance is up for discussion unless the commission would like it to be, but a little bit about the expiration dates of the ordinance and then what the staff has proposed thus far in terms of an extension.
Good thing. Thank you, City Manager. So the temporary ordinance that has been prepared by staff at this point is very similar in its makeup to the one that was done a few months back. Really the only difference is the sunset date was modified with an eye toward when would be a reasonable likely time frame in which the general Yankton population would have had access to a vaccine of some sort and have had the ability to obtain that vaccine and get its immunization qualities by the point the mask mandate would sunset. Of course, that's imperfect because we're just going with kind of national guesswork that's presented in the the national media, but it was based on comments made by Anthony Fauci, and that's kind of what guided our decision. We went with the last, so it'd be the Friday after the last commission meeting in May as the sunset date, with an understanding that if that vaccination time frame didn't hold true and there were delays in distributions, that still gives the commission an opportunity in May to impose, if they had the will to do so, an additional temporary ordinance to go beyond that. And that publication date, based on consultation with Colleen Bailey, we believe that Friday would be probably the most likely publication date of a new ordinance. So that last Monday meeting in May would be the date of passage, and then it would be published by that following Thursday to be effective that Friday. Would you like me to go through any of the meat of the ordinance, or are we all comfortable with what it says with the one that's already on the books?
Ross, I think most of us are familiar with the ordinance and the fact that while it is a binding ordinance, the enforcement is not there's not a penalty under law, so there's no fine associated or anything like that. I think really what our purposes of the today is to, you know, determine whether or not we recommend that extension, or we recommend a different date, or we don't recommend that extension. So the health board is aware. What I'm hearing is there has been a little discussion about maybe making this date commensurate with the end of the school year. Um, I've heard over the course since the commission has implemented this ordinance, positive and negative things. Um, However, more positive than negative. I've also continued to watch our numbers. Numbers, of course, have gone down, which is awesome for everyone. Whether that's causal or not, I think it depends upon what side of this argument you might be on. But you know, we have seen a decrease in cases in our county and in our state, which is wonderful. Um, I have heard also from the public some concern about, you know, as more people get vaccinated, how do we hang on to this ordinance? How do we continue to, you know, impress upon people that it's important? Those are just discussion items that I'm hearing. So I guess I would like to hear the opinions of the health board members as well as the ex officios in terms of what they think is best. And then we can talk about any motion or you know, anything that we would like to recommend to the commission so they can make their decision.
Can we hear from the law enforcement perspective on how the ordinance has gone so far? If they encountered issues, challenges?
So from our perspective at the police department, we have not had any issues or challenges with the ordinance. I can't say that anybody's complained. I do know that when I go out in the public, I see people wearing masks. Some people don't wear masks, but nobody's actually called in and said, "Hey, we need to enforce this," or anything like that. You know, that's just one of those opinions that people have. Some people are going to do it for the good, and some people are just absolutely totally against it. So um, I think it's been fine from our standpoint over here.
The only thing we legal, you know, that's nice to know in terms of police calls. I've had some what just call community calls of people outing businesses or people at businesses saying, well, I was in this business and the employees were not wearing masks, or, you know, the individuals in they weren't enforcing wearing masks, or they don't have a sign. And then we've made a call, you know, to the place of business and just gave them kind of a reminder, tried to be friendly about it. So we have had that kind of complaint, I guess, but I would call it more of the sort of outing of people than or shaming than really any kind of problem with that.
Dr. Miller, I guess I would open the floor to you before I chime in with my thoughts. I'm interested to hear what you have to say.
Okay, sure. I would say that the evidence for the effectiveness of masks is certainly a body of scientific evidence that is growing. And I think that there is more acceptance of masks as certainly a inexpensive, effective, easy to use way to decrease infection. And I think that even the CDC came out with kind of their scientific brief on community use of cloth masks to contain the spread of SARS-CoV-2 at the end of November. I think that the federal government had certainly issued their new federal mandate for the wearing of masks on public transportation and in federal buildings. I think the state of South Dakota has Senate Bill 125 before them now, requiring a statewide mask mandate. So I am certainly very encouraged with the fact that Yankton numbers have improved significantly. I think our hospital capacity has improved. Um, I would like to think that it is due to the community efforts at masking, distancing, hand hygiene. I think that the community's been very respectful and responsible in that. I think it's showing good effects. I think that we can all be very optimistic as the vaccine is rolling out. And so fortunately, I think we're starting to see the end in sight. And I would say I think it's too early to sort of drop the ball at this point. So I would strongly encourage the health board and the city commission to sort of stay the course on the mask mandate. And at least in May seems like a reasonable time. And so I guess I hadn't had a strong opinion about end of school, end of May either, but I'm certainly willing to listen to discussion on that. But I think the thing I feel strongest about is definitely I think we need to stay the course and recommend that the mask mandate stay in place temporarily and extend it.
The other thing I'll remind the Commission of Health Board members is that when Ross, or I will, that if for some great stroke of luck we get a lot of vaccinations done and we've reached that point where we're not
Right.
seeing other strains, that this can be dropped anytime. We can do that with an action of the commission, and we can do it even if we need to a special meeting. So extending it, if there's concern that late into May or summer is too much, or gets to be middle of spring and we're all vaccinated, which that'd be
Yeah.
amazing, then we can back off always also. So that's an opportunity as well if conditions change.
I think that Avera has been very efficient in distributing vaccines, and I think they're even setting up a facility out at the portion of the Yankton Mall, so that I think we can be optimistic that there is a very good chance that community vaccinations will be underway. I think a lot of it depends on supply, which is certainly out of Avera's control, and so there are just a lot of unknowns, but I think having that portion in the ordinance where it could be dropped, if suddenly they just are great at getting them to Avera and getting them to the community, then certainly, hopefully, we could let that expire sooner.
Yeah, Vera has distributed more than 4,000 doses of vaccine so far, and that would include both first and second doses, and that's not all Yankton County residents, because Vera Sacred Heart also covers Union County, so that includes a lot of their first responders and healthcare workers. You are correct that the public, as we move into the 1D priority, which is now the 75 and above, and those receiving care for cancer, dialysis, and transplants, that clinic will be at the Yankton Mall by appointment only. So there is great progress there, but as you said, it's greatly dependent upon the supply. And I know there's a commitment from Vera Sacred Heart to, if they are offered vaccine, they're going to take it and get it out to people. So I'm very confident that that process will continue to be very efficient and effective. And this week, we also learned that some pharmacies will be getting vaccines, so that's another good sign. However, there is a ways to go. I visited with Dr. David Basil this week, who's the Vice President of Quality for Avera, about questions that have arisen about herd immunity. And in his opinion, there's no evidence that we've reached herd immunity based on antigen testing that he's seen. It's maybe around 20% of our population who has had COVID at this point. You pair that with about 10% of the population has received vaccine. So best case scenario would be 30% of people have immunity. And we know that's not the case because some people have received vaccine also had COVID. But we really need to get that 70 to 80% immunity before we have herd immunity. So we're a long ways away from that. And I think as we learn more about the B117 variant of coronavirus, that is much more infectious, that is creating concerns. We've seen in some other countries where it spreads so fast. So I would hate for us to be at a point now where we have low numbers in our area, vaccine is rolling in, and to totally let up our guard and just say we don't have to worry about this anymore. I think continuing with the mandate is an easy way that we can gently remind people with this ordinance, since it's not enforceable, that we believe they should be wearing a mask and that we're all in this together. Peer pressure can be a powerful tool, but as we've seen, there are people that don't wear masks, and that's just the reality we're in too. But to me, as a community, the mandate is a way for us to tell people this is the right thing to do where we're at now. We are all in this together. Even if you've gotten the vaccine, you should still be wearing a mask because we don't know if you can still infect people, if you can carry coronavirus to others. That's a question that's out there. But then even bigger picture, I think it's just important for us all to stand in solidarity with one another until we can say none of us have to wear masks. And I would like to think that that day will be kind of this May time period that we're looking at to sunset the ordinance. I think all of us here would love to just say, no, we don't need this anymore. But let's be smart about this and take advantage of this decrease in cases and do all we can to get everyone vaccinated so we don't have another surge. I think it's also important to mention that with the bill that's in the Senate, or was in this, I guess it was defeated in the Senate yesterday, I believe, for the mask mandate at the state level. Avera Health, Sanford Health, and Monument were all supporting that mandate, so they are all still on board with this approach. And I think if you look at our flu cases in the state, that tells us a lot about, I think, the mitigation efforts that we've taken against COVID and how that's affected flu numbers as well. Some people may think we're just counting everything as COVID and they're not testing for flu anymore. That's not the case. The numbers I saw on the Department of Health website said we've done 4,000 influenza tests, and there's only been 101 positive cases, only 6 hospitalizations and 2 deaths this season. I couldn't find the 20 or I didn't see the 19 to 20 report on the state website, but the 20 to 2019 season, there were more than 9,500 lab confirmed cases with 653 hospitalizations and 43 deaths. That's a big swing, and I think a testament to the infection control efforts that we as a society have taken during this particularly challenging and dangerous time.
Health board members, do you all want to give a little bit of a comment from your perspectives as to where you think this ought to go?
I'll be very brief, even though I've read quite a bit and done a fair amount of research myself, and a lot of the statistics that have been referenced so far are the same things that I've been seeing. The shortest answer, from my opinion, is I don't know why we would change what we're doing right now at this point in time. I think we're a few months away from that consideration yet. Hopeful that things will improve to the point where it might be less time rather than more, but I'll leave it at that. I don't know why we would change what we're doing right now.
And I won't I won't belabor the point by saying anything that folks have said before. I think I generally agree with that. I'm a supporter of masking on the merits. For me and my family, it's important, and I like to say I sincerely appreciate everyone who wears a mask and maintains social distancing, regardless of what they believe about the efficacy or the politics of masking. And as the commission considers this, I hope we can avoid the sort of angry and contentious conflict on both sides of the issue that we've seen in the past. We appear to be at a tenuous status quo in the community, and this would be a poor time to reignite divisions without any clear benefit. The repeated angry conflict just wears down folks on both sides of the issue's ability to see the humanity in one another. And I would hope that as the conversation continues, that would be at the forefront, maybe not the science, maybe not the efficacy, but the humanity at the core of the conversation, and that folks who disagree, you know, do so in goodwill as much as possible.
Jason or Ross, I guess, has his light on. Ross?
I really don't think I've got a lot to add. I thought excellent comment, Brad. I think the status quo appears to be working. We look at our numbers, and it's been a steady decline. I agree. I don't think there's really a lot of sense in changing what we're doing right now, because nothing else has changed until we get the vaccine. It seems like it makes sense to me that we leave things exactly the way they are. I think that when this ordinance went into effect, my anecdotal perceptions were that there is some amount of better mask use about town. Clearly not 100%, but it just seems like we're trending the right way. So I would sort of, my personal belief, I'm not really supposed to have a personal belief, but it seems to me the status quo is what we ought to try to protect. So that's where I sit.
I'm basically on board with how Dave put it. I would really like to see if Avera can give us, more information on how far they've gotten in the vaccination process before we change the date, or maybe requiring the mask mandate. Also seeing the effectiveness of the vaccination. Has it protected the people that are most vulnerable, effectively, before we go changes something? Because it is working. It shows that in the statistics, and I think we should keep looking at that. It could be a month down the road, could be a little further down the road, but I think just keep an eye on that situation before we start making changes that could drastically affect the community. So.
Katie, would you like to add anything?
Yep, can you hear me okay? Perfect. I would just agree and echo, what everybody has commented on. I think that it's important, I think Nate had pointed out that, hospital capacity has improved. There was a lot of discussion when the ordinance was being put into place and supporting the safety and the capacity also of the hospital system, and improving, that workflow for like healthcare workers, kind of relieving that burden and the stress that was great upon them during the surge. And so I would just comment, as I'm walking the halls of the hospital and looking at the local nursing home, being able to kind of keep that at the forefront, that we are having capacity to take care of our neighbors and our friends. And that's really important. And so I think everybody is kind of breathing a sigh of relief. So let's not change, what we're doing well. And it's clearly working. And I would just also echo that, when we're looking at vaccination distribution, I'm really encouraged that the ordinance, that it's flexible, that, if we don't, because there is so much that's not in our control in terms of vaccine allocation and, then obviously that impacting the distribution to our community, that even if we reach that May date and we're not at the numbers that we need to be to feel comfortable in terms of safety for our community and rolling back the mandate, that we have the flexibility to extend it beyond that if we need to. And I just want to point that out because I think we all are really hopeful and Avera is doing a great job, but there's a lot of it that's not in our control too in terms of allocation of vaccine. And so I think just to kind of keep that at the forefront that we all want it to be shorter lived, but there is the potential that we could have to extend it too if allocation doesn't go as we had hoped it did. So thanks everybody for your comments.
Yeah, thank you. I mean, I think it's clear that we have a really thoughtful group here and looking at this from a lot of perspectives. I certainly know that the feelings about masking philosophically and, looking into some of the political aspects or personal freedom aspects, people have different opinions on that, certainly. And I definitely respect those. Um, and my recent vote on the health board with our last recommendation reflected that, um, which was an abstention for those who don't remember. But in that, I will say, I think that uh, we have firsthand knowledge that the masking can help prevent the spread, and it's a good thing to do. So um, we could still have surges in our organizations, or we've still got school going as well. School's done an excellent job, but we're still in session. I think we should stay the course, as the other health board members have said and the ex officios have indicated. I think it's important for our community and important for our country as well. We still have masks available for people who um, don't have access to masks. We've gone through a lot of masks already, but we have those available for people. Our officers have those for those that they may come in contact with. Um, we have our signs, which are available, but we can also provide them to you in a link, or there's a link on our website, so folks with businesses can print those off and should have some kind of sign indicating that masks are required. Also, I have seen some people put those in their houses, on the doors of the house or in the windows of their house. As I walk around the neighborhood, I've seen my neighborhood and others, I've seen that, and that's kind of a neat thing. So people just know what the expectation is. And so with that too, I would encourage, you know, friendly policing and friendly reminders to each other. When you see folks, hey, would you mind putting a mask on for our safety and things like that? And I know I've done that with folks, and people generally respect each other, and will do that. And we've done that here at City Hall, to say, hey, we have a mask ordinance. Would you mind putting a mask on? And folks have complied. So I think that, we'll certainly hear public comment at either the first reading or the second reading, and folks can submit written comment. I really don't expect that um, anybody's opinions have changed, but we'll certainly take that, and I'll provide that to the commission if people um, have things that they want to say or share with the commission in terms of the masking ordinance. So with that, I think someone should maybe formulate a motion, and maybe as specific as we can be for the commission. What I will do is share that with the commission over email today. They already have their packet of information for the meeting. So, and then I'll reiterate that with the media today. The mayor and I have a media review, so they understand that, what the health board's recommendation is. And then we'll, barring any big change from the commission on Monday, we won't probably need to meet again for a while. I'm hopeful of that.
Dr. Milroy, do you want to make the motion, or I can? But I think it'd be great if you.
Yeah, I'm happy to make the motion. And I guess I don't know the exact wording to do, though I'll let Ross kind of work with that too. But I would make the motion that yes, we make a recommendation to the city commission to extend the mask mandate. And I would definitely leave the clause in there about the flexibility about when it would sunset, and that would depend upon the community vaccination rate and also really what's happening as far as I guess disease burden within the community to make that determination. But know that at some point it would sunset, and so I don't know the exact wording, but yes, I would make that motion that yes, we should extend the mask mandate.
Just for
just a-
clarification, are you indicating, Dr. Milroy, that May 28th date or a different date?
I will say the May 28th, as was recommended originally, is what I would make that motion.
Okay.
The point of clarification for your motion, if I may, real briefly here. It's a semantic issue, but technically accurate. I think this really isn't an extension because we didn't have the ability to extend the previous ordinance. This is basically a replacement ordinance that does the same thing with merely a different sunset date. So it'd be a recommendation to pass the new or replacement temporary ordinance, if you will.
And I was using the wrong vernacular
Great.
than earlier, so I didn't go to law school, so pardon me. But
That's okay.
a replacement.
Yeah, thank you. I'll let Ross do the wording because I didn't go to law school either.
Sorry, it's kind of a silly technicality. I apologize.
So
That's why you're here. We want it right.
So the motion is to then, as I understand it, replace the existing mask ordinance with an identical ordinance and new date of sunset, which would be May 28th.
And I'll second that.
Okay, we have a motion from Dr. Milroy, a second from Mayor Johnson. Those voting members, all in favor of the motion, signify by saying aye.
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 Aye. Opposed, same sign. Should be none. So that motion passes, and that's our recommendation to the commission. I will share the link with you to the meeting on Monday. There may be some deliberation on Monday, although it is a first reading. Again, the vote will not take place until the 22nd of February. I think
And
our work is done.
We should probably make clear, Amy, for the viewing audience, that on Monday night, we will not be taking public input. We'll be doing that during the second reading. So
Sure.
at our second meeting in February.
That's the mayor's purview.
However, you can email us or call in with your input at any time, of course.
I'll provide any input to the commission that's submitted, and give that to y'all, and you can decide, if you want to read it you want to read it when we do have our second reading, we can certainly do that. Okay. Is there a motion to adjourn the health board meeting?
So moved.
I'll make the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
Aye. Okay. Thank you very much, and for everyone's input, and we'll see where the commission takes this. And thanks to our IT for
See everyone.
providing this and live streaming.